Hello, I'm Michelle Fox. Welcome to another edition of Today's Health. Today we're going to be discussing shoulder injuries and common causes of shoulder pain. Our guest today is board-certified orthopedic surgeon Dr. Leonard Karadimas. Dr. Karadimas, welcome to Today's Health.
Thank you, Michelle. Good to be here.
Now, as we talk about the anatomy of the shoulder, what are the parts that we're dealing with?
Well, I happen to have a model here. It doesn't have the soft tissue or cartilage, tendons, ligaments, but it has the basic bones. I'll give you a pretty good idea of what we're talking about. The humeral shaft is the long bone here in your upper arm, and that connects to the humeral head or ball. And then you have a socket, which is called the glenoid. Now, the socket really is attached to our scapular or shoulder bone. When those two meet, of course, that's your ball and socket joint or glenohumeral joint, the shoulder proper. There are other components to that, Michelle. There's a collarbone or clavicle comes across right here, and that would attach somewhere in this area. That's not in this particular model, and that's really included in the shoulder joint proper. But essentially, most of the times when people refer to the shoulder, lots of times they're talking in general the actual ball and socket joint, the glenohumeral joint.
Looking at the shoulder model, which areas are the most susceptible to injury?
Typically, it's going to be the non-bony structures, right? The bones are pretty hard, and certainly you can fracture things if you fall on it or you sustain a substantial amount of trauma. Most of the times, though, you're going to injure the non-bony structures, the ligaments, the cartilage, the tendons, like the rotator cuff tendon, for instance. It's a much softer thing to injure. It's like taking a 2x4 or a rope and putting some stress on both. You put enough stress on that rope, it's going to break. You could break the 2x4, but it's much harder to do that.
What are the most common causes of shoulder problems?
I'd break it down into two things. One is going to be trauma, injury, and that can be a variety of traumatic events, from falling directly on it, throwing a ball or a pitch too hard, and your socket your ball sort of slipping out of the socket a little bit. So let's just say some general traumatic type injury. And then the other one would be repetitive or degenerative or overuse. And that basically is, over time, things are going to wear out. And typically in the shoulder, there are two main things we're talking about: the ball and socket, the actual joint itself, where the collarbone, the clavicle meets the shoulder, that joint can wear out. And then the soft tissues, like we talked about, over time, those ligaments, you put enough just wear and tear stress on them, and they can stretch out, they can loosen up, like a pair of jeans could over time, I guess. The tendon, if you put enough pressure through it, or you injure, pressure, trauma, some wear on that thing, that could fray or start to tear up.
What are the most common symptoms of a shoulder condition?
You could have pain, certainly, and lots of times when in an acute traumatic situation, you're going to have pain, discomfort, swelling, sometimes occasionally some bruising. Most often, in general, what you're going to see is pain, limited motion. Sometimes you can have pain that radiates down into the upper arm, the biceps or triceps area, more commonly in front here, the biceps. And something that, if you've ever talked to somebody who's had shoulder problems, they'll tell you it's painful at night. Night pain is a very classic problem with rotator cuff issues. That socket, the ball and socket, can shift around a lot when that tendon is working well, and it can be very uncomfortable for someone to try to sleep.
Now, some people out there might injure their shoulder or have a little bit of discomfort maybe after playing some football or, goofing around. How do they know when it's time to seek medical treatment?
Well, usually I would, if somebody has any persistent problems that extend over a month, I think that's a reasonable time to probably at least have a look at it. More importantly, when you notice that you're getting some progressive limited motion, what happens is your shoulder hurts you. And it hurts you when you move it a certain way, so you don't move it. And then over time, you can start getting reduced motion. You can start getting some scar tissue that occurs, and that can be a very big problem for us, for the patient. So I think anytime you have persistent pain for over a month, loss of normal motion in the shoulder, intermittent pain that lasts greater than 3 months, pain when you try to sleep at night, pain that radiates down into the upper arm, those are all good reasons to seek medical attention.
Now, you hear, too, that people who might be having a heart attack or heart problems would have some pain that might radiate down one of their arms. Is there a way to tell the difference?
Well, usually with shoulder problems, you're gonna have a progression of problems over time. It's not gonna happen. You're not gonna have severe, go from no pain to severe pain in a matter of a couple of hours. That's unrelenting. Certainly there can be some overlap there. I'm not suggesting that you couldn't have a shoulder problem and then you have some type of cardiac issue on top of that, and it kind of mimics that. But usually with musculoskeletal problems, they're going to be reproducible. In other words, you're going to have pain, but when you move your arm, it gets worse. With cardiac things, you're not going to have that. Or when you push somewhere, it's going to hurt in the shoulder. If it was a heart issue, you wouldn't have that. And again, we're talking about time frame here. If it's something that's acute and sudden without an injury, then that certainly is something that you should get immediate attention for, and probably not musculoskeletal.
Well, it's time for us to take a break now. When we come back, we'll talk about the rotator cuff.